Hello, I'm Ashis Brahma. I'm a medical doctor specialized in communicable disease control. I've worked in many countries over the world in different continents, and I've been part of outbreak control in hepatitis, in Ebola. Currently, I work in the Netherlands in the public health municipality in Gelderland called Noord- en Oost-Gelderland. Here currently we have a COVID-19 outbreak, or commonly known as Corona, and I think I can take the messages and the learned experiences from Africa and Asia, from South America, to what I do here in day-to-day work. And the most important issue is that we listen to the community and that we talk with, not about the community, about this disease. I want to tell you a little bit about the situation in the Netherlands, what's going on in the Netherlands and what's going on globally. And I want to talk about some very important themes, what's important and what we as human beings can do about it. Because it's a rare event. Some people would call this a black swan. So if I can tell you a little about the situation in Holland, about a week and a half ago we were all without corona infections in the Netherlands. But currently we are having infections over 1,500. And those are the confirmed cases. That means that we have done a test that was confirmed by a laboratory. But for every case of confirmed corona, there are several cases of unconfirmed corona. And what we see is that we have a society that is fearing this disease. And for some reasons that is very right. It's a very lethal disease for certain groups of risk populations. And those risk populations are people above 70, and those that are suffering from kidney, lung, and heart disease. And yet, as I said before, there is always hope. There's always things we can do to try and make this pandemic less fatal and less morbid. I'd like to illustrate with a graphic what is the problem with corona and why it differs from another infection like influenza. So I'm going to the board and draw it here to make a drawing for you. It's a very simple graph, frankly. In every outbreak, you would see a peak. So the peak of an infection usually is like this. But there's a capacity that our care system, our hospitals, can take care of. So this is the amount of hospital beds. This is the amount of specialized intensive care units. So what we try to do with this outbreak is to make sure that the peak is lower and that we will have the same amount of people being sick, but that we try to avoid the maximum capacity of our care system. So the graph would look more like this. It'll be a longer infection, the same amount of people being sick, but the capacity will be within the capacity of hospitals. To understand the coronavirus, I have to explain you something that is an epidemiological concept, which is called the R0. R0 is a simple thing, which means that for every patient you have, that there's going to be somebody else infected. In the case of corona, when there is no intervention, the state does nothing, you may see that the R0 is 6. And what does that mean? That means that one person may infect up to 6 people, which is a long time to draw. Overall, when governments intervene, you will see that the R0 may actually be closer to 2. So 2 people get infected for each and every person with coronavirus. The ideal would be to get it as close as possible to 1, because when you have 1, the epidemic will be a linear function, which means that there's not going to be a massive spread as there's currently going on. In different countries, there's been different success. In China, you can see that currently there's no or very limited amount of transmission or spread of the disease. And it's because there have been very stringent measures being taken place, running from quarantine to home isolation to treatment to cleaning and explaining and importing of thousands of doctors and nurses to take care of this outbreak in Wuhan. And so it took China over 3 months to address this issue. And we're seeing problems in Italy and in France and even in Holland and in Germany. So what we as communicable disease specialists advise is that you as a citizen can play a large part in containing this outbreak. There are 3 phases in the containment or in the mitigation or the acceptance of the situation of corona. The first phase is when you try to trace each and every single case of corona. And when you try to do that, you try to make sure that the spread is halted. You would do your best to isolate and quarantine as many people as possible. But because I said earlier about the R0, the spread, that up to 2 and sometimes 3 people get infected per patient, that you will see that we enter into the mitigation phase. The mitigation phase is when you try to make sure that people get sick. Well, you don't try to get sure that they get sick, but that the amount of sick people at the same time reduces. Overall, the number of sick people remains the same, and the idea is to make sure that our healthcare system can cope with what's going on. If you take your hands off the buttons and try to do limited amount of interventions, you will see a natural spread of coronavirus taking place. Some experts say up to 60% of people globally will be infected with corona. Now, most people may not get sick, but the people that get sick may get very sick, and especially our elderly, above 70, or people who have underlying conditions like lung, kidney, or heart problems. So we've seen in China about 80,000 cases, and there was a steep logarithmical increase of the number of cases, and then we see a flattening, a so-called S-curve, and then we see a decline of the number of cases in China until the point that we're almost at 0. In Italy, the numbers are going up, and I hope that we reach a plateau phase very quick, because they've tried to quarantine and isolate and make social distancing and maximum measures possible so that the spread of the disease, the spread of COVID-19 is reduced. In the Netherlands, we're still going upwards very fast. We're still in the phase that we can hopefully avoid many, many cases. But if we test not everyone, we will not know the true situation. So 1,500 cases currently in the Netherlands may represent more cases. And as I said earlier, our national expert is saying, and the leader of our communicable disease outbreak control is saying that up to 50% of the Netherlands may be infected this year and over the next coming years. Something else about corona is the fact that we have not gone through this disease. This is a totally new disease. So unlike flu, nobody has immunity. And that's the difference that it makes, that everybody's still susceptible for the disease, unlike in flu, where most people have gone through a similar or the same type of flu. 100% available for the virus compared to less people available because they have already gone through and are immune or partially immune for a flu infection. So what can you do as citizen of your country? Well, there's a couple of simple tips. The first of all is when you cough, you do it in your elbow. The second thing is when you use paper handkerchiefs, you throw them away after one use. The third thing is when you are sick with a flu, with a cough, or with shortness of breath, you stay home. Most countries will advise you that when you have symptoms of the disease to stay home anyway. Think about those people that are vulnerable. My father is 87 and has diabetes. I'd like him to be around the next summer and the next winter. So all of you have people like my father in their near and dear. You may have a son who has asthma. You may have a sister who has a disease called Crohn, and they're vulnerable to this disease. And I'd like to ask you to consider those people. It is very hard to stay at home, not to go to school, not to go to university, not to go to cinema. But think about it. You have an uncle, a father, a child, or a friend who needs us to make sure that we spread out this disease so that our hospitals and our caretakers and our homemakers and our hospital staff can do the work they need to do. In the course of my medical career, I've worked in many countries, and I've been involved in outbreaks of hepatitis in refugee camps or Ebola in Uganda. And I've learned a couple of things. The most important lesson is that people can take care of themselves. They need proper and good instructions, and they need support to take difficult measures. But the outbreak of hepatitis in the refugee camp, or the outbreak of Ebola in Uganda was controlled by local authorities. This makes that in a global world, we need global authorities and local people coming with global solutions. And I think we can try and address the issue of COVID-19 only if we all work together. As a communicable disease expert or working as an ID, infectious disease doctor in the hospital, this is something that we all do not fear, but what we wait for to happen. Sometimes something big happens and we are prepared for that. And it takes sacrifice. Many of our colleagues in hospital and outside of hospital are sick with COVID-19 right now because they are taking care of patients in the hospitals, in the intensive care units, or in the hospital per se. This is the time to rise and shine as medical community and to show that we care and that we do our best. We need the support of all involved in society so we can do our task well and try to reduce the number of people who will die and reduce the number of people who are severely ill.